What are the top 7 things you need to know this annual election period for choosing the right plan for 2026? Hi, I'm Chris Sprang. I'm the Medicare analyst. I'm a licensed agent in 17 states. My goal is pretty simple, is to help people like you make a wise and confident decision about all other Medicare choices so you can protect your income, your assets, your savings, and your health. I want to help you find, especially this year, a good solution for 2026. So what are the 7 things you need to know this annual election period? Number 1, it starts October 15th and it runs through December 7th. That is the time of year that you can review your current coverage, whether it's a Medicare Advantage plan or a drug plan, and see if it makes sense to make any sort of change or just stay where you are. Now, if you fail to make a change during that time frame and you have a Medicare Advantage plan, well, guess what? You get a second chance. From January 1st to March 31st, you have what's called the Medicare Advantage Open Enrollment Period, where if you didn't make a change, you can. If you made a change and went, oops, that was a bad idea, I want to switch back or get something else, you can do that during that time. That does not apply to your Part D drug plan. So Part D, if you have a standalone drug plan, you need to get that taken care of between October 15th and December 7th. Number 2, an estimated 2 million plus people will be losing their Medicare Advantage plans and or drug plans for next year. That means a lot of turmoil, a lot of people are going to be very busy, a lot of things are going to happen, and a lot of those people are going to flat out overlook that their plan has been terminated. So if you're on a Medicare Advantage plan, you want to be looking for your termination letter, especially with certain companies. United Healthcare is terminating 600,000, Humana about 500,000, Anthem about 150,000, Aetna is terminating plans. Some plans are shuttering the doors altogether. So you want to be looking for those termination letters. If you're on a Part D drug plan through Anthem Elevance, they are terminating all of those. So you want to look for the termination letter. The termination letter is very important for people on Medicare Advantage because in that letter, what it will tell you is you now have a guaranteed right to get a Medicare supplement. So maybe you couldn't get one because you had health issues. Well, guess what? Now you can because the plan has been terminated. So you want to make sure that you hold on to that. Number 4, you should review your coverage with whatever else is available next year. You don't have the only plan in the market. There are many more plans to pick from. So if your medications have changed, if your doctors have changed, if your network has changed, if you're on a Medicare Advantage plan, then you definitely want to do your due diligence and make sure that your plan this year is going to be equal to or better than the other plans that are available. Perhaps another plan has better medication coverage. Perhaps more of your doctors are in network in another plan, or it has a larger network or has greater flexibility for using providers. And if you're on a Medicare Advantage plan, there's a high likelihood that you could very well be on the wrong plan. So it really is important to check, again, to make sure the medications are good, your doctors are good, the benefits, how low is your maximum out of pocket? Do you have one with a high and you could get one with a lower? The lower, the better. The 5th thing you need to know is more and more states are enacting what are called birthday rule laws for people on Medicare supplements. And what that law basically is, if you have an existing Medicare supplement policy in those states with birthday rule laws or an anniversary rule, then you have a guaranteed right around the time of your birthday to make a change. If you can find a lower premium on the exact same plan, or perhaps certain states a different plan, then you are guaranteed to be able to make that switch. Whereas in most cases, and still in most states, then you would have to go through medical underwriting. So more and more states are doing that. And basically what that means for some people that have been stuck in an escalating premium and they're paying a lot per month and there's no way they can medically qualify to get a lower premium, well, guess what? They're probably going to be able to save some money. The downside is, in the end, everybody is going to end up paying. More and more states are enacting that. So you do need to be paying attention to that, especially if you are on a Medicare supplement. The number 6 thing you need to know is for Medicare supplements is the premiums are likely going to continue to increase at a higher percentage rate than they had in the past. The past few years, we have seen some significant increases, not just 10% on plans, but 15, 20, 30. I have seen 50% increases from one year to the next on premiums for some people in some areas. And I expect that to continue for a couple reasons. One, with all the Medicare Advantage plans terminating, those people now have a guaranteed right to get a Medicare supplement. They don't have to go through underwriting. They're going to have to, in most cases, get the Plan G. So that means the insurance company has to accept them and they don't get to underwrite them. So now you could be bringing in an unhealthier pool of people into the rest of the pool, and therefore everybody else is going to pay more. And the other one, as I just alluded to, is all the birthday rules. When they have to accept people guaranteed and they can't underwrite them, that means they got to escalate the premiums. That's the only thing that they can do. And as long as this continues with Medicare Advantage plans terminating, more states doing the birthday rules, I would expect premiums to continue to increase. And number 7, if you are from one of the states I'm licensed in and you need my help for 2026 in finding a really good solution and making a wise and confident decision, then by all means, feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about all your healthcare needs, philosophies, and budget. And of course, I'll do my best to help you make that wise choice. I'm Chris Prying, the Medicare analyst. Make it a great day.